not merely little people. Most of the childhood conditions are unique and merit special attention. Never again in his life is an individual confronted with more dramatic challenges than in this transition from a dependent existence inside its mother's womb to an independent life outside of it. The neonatal period, consisting of the first 4 weeks of human life, is unquestionably the most hazardous in human existence. What exactly is neonatology? What is its importance? What are the special problems faced by the newborn children? What are their causes? How can they be treated or even prevented? What are the important aspects of newborn care? This is what Dr. Sunil Kumar at Nilofer Children's Hospital, Hyderabad had to say.
Neonatology is the field of medicine which deals with problems of newborn babies till they are 1 month old. These problems are very much different from the diseases of children or adults. It is very important to know their problems because many of the physicians are not aware, and also their only language being cry. Even parents also cannot describe what the baby has got exactly. The mortality in the first year of life is known as infant mortality rate. It is interesting to note that 50% of the babies that die within the first year are dying within the first month itself, and half of these are dying in the first week of life. Half of this figure are dying on the first day itself. So that shows the importance we have to give for caring babies in the neonatal period. The normal birth weight of a baby in India is 2.8 kg. If the birth weight is less than 2.5 kg, that is called as a low birth weight baby. There are various problems these babies are going to face due to system immaturities. The important causes of low birth weight in India are poor socioeconomic status of the parents, poor maternal nutrition, and maternal systemic disorders. If the baby is born before 37 weeks period of gestation, that is called as a premature baby. The normal intrauterine period of gestation is 37 to 40 weeks period of gestation. This much period is essential for the normal functional maturation of the body systems. So if a baby is born premature, not only its weight is going to be less, but also the various system immaturity problems also will be there. If a baby is born before 37 weeks, and more so it is premature, the more will be its problems. The important causes of prematurity are socio-economic status of the mother, systemic maternal disorders, antepartum hemorrhage, certain fetal causes like multiple pregnancies, congenital malformations, in infant of diabetic mother, fetal hypoxia, and rhesus isoimmunization. In the last 6 months, the weight of the baby will be gained very much. If the newborn baby is losing this last trimester, which we call that is the last 3 months, then the gain due to carbohydrates, fats, vitamins, minerals, and proteins will be lost. So this baby will be devoid of these factors which we have mentioned. That is the reason this period is vital for the weight gain of the baby. The morphological features of a premature baby are very characteristic. As this baby is seen here, it is born at 30 weeks period of gestation. The birth weight of this baby is 1.3 kg. The head looks proportionately large compared to the size of the body. The skin is thin. Breast nodules are not well formed. Ear cartilage is thin again. Eyes appear protuberant compared to the size of the head. The genitalia are also not well formed. The premature baby has got several functional abnormalities. These are pertaining to each and every system of the body. The central nervous system abnormalities of premature babies are they are very much prone for aspiration because of the lack of development of sucking, poor swallowing, and they are likely to aspirate at this period of time. The temperature regulation of these babies is immature because the thermostat mechanism is not well developed. So they are prone for achieving the temperature of the atmosphere in which they are kept. They can have problems of gastrointestinal system as the enzymes are not mature completely. The immaturity of the central nervous system is expressed as inactivity, poor swallowing reflex, poor sucking reflex, and poor feeding. The temperature regulation of these babies is also problematic as the thermostat mechanism is not well set. If they are kept in a cool atmosphere, they become cool quickly, or if they are kept in hot temperatures, they become too hot. So, as they cannot control their body temperature, they should be monitored according to their need. The gastrointestinal system of these babies is immature. There is poor maturation of enzymes, and the liver maturation is also not proper as evidenced by liver function tests. These babies are prone for high incidence of hyperbilirubinemia, that is increased incidence of jaundice. Because their central nervous system is not mature, their blood-brain barrier is also not adequately mature, so they are prone for toxic effects of bilirubin, resulting in kernicterus. The renal system of these babies is also not mature, hence they are prone for drug toxicity. This surfactant material is essential for preventing the collapse of the alveoli, which is essential for adequate ventilation and perfusion. So if the ventilation is not normal as well as perfusion is not adequate, baby can suffer from problems of hypoxia, that is oxygen supply to the brain is not proper, resulting in birth asphyxia or hypoxia. The problems of hypoxia can be varied. They can result in acidosis, sometimes intracranial bleeds also. The cardiovascular system complications of a premature baby are due to delayed closure of ductus arteriosus. This is known as PDA. So, from this, if the baby suffers cardiac failure, certain drugs are required to treat this condition. It is possible to close the ductus with drugs. If it is not closing with drugs, we have to go for surgical intervention. The prevention of premature labor is very, very essential because womb is the best incubator available so far. Adequate bed rest will be given to the mother. There are certain drugs if given at the initial period of onset of premature labor can be postponed. Drugs like isoxaprine, terbutaline, salbutamol, if they are given early, premature labor can be postponed. If premature labor is imminent, in such cases, betamethasone should be given the dosage of 12 milligrams as 2 doses at 18 hours intervals. That will decrease the incidence of hyaline membrane disease in the newborn baby, in a premature baby. So the complications to these babies will be reduced. In case premature birth is a must, that is if it cannot be avoided, baby should be monitored well, temperature regulation should be taken care of. In case if adequate facilities like incubators are available for monitoring the temperature of a baby, it is well and good. If not, warmers can be used to increase the room temperature. The nursery temperature should be kept around 28 plus or minus 2 degrees centigrade, because at this range called as thermoneutral range, baby's metabolism will be kept at a low ebb. Babies should be taken care of adequately by preventing infections, because these babies are very much prone for infections because of the poor immunological mechanisms. In the nursery, we have to leave the slippers outside, and if you are handling the baby, we have to change the dress also. But the most important step is washing the hands well. we have to wash our hands 3 minutes before touching any baby, and in between examining babies 15 seconds of thorough hand washing is essential, because we are the person transmitting infection to the babies. So this step is very essential in dealing with newborn babies. Wearing gloves and masks is essential during certain procedures like exchange transfusion, that is changing the blood of the baby. Transport of premature babies from a peripheral setup to an area where facilities are available is very important, because this is the crucial part that is going to decide the survival of the baby. Temperature maintenance during this process is very important. Hot water bottles and cotton wool can be made use of for preserving the temperature of these babies. The mothers of premature babies need not be afraid of, because there is adequate literature available regarding the survival of these babies as well as their future intellectual. They may be completely normal and they can compete with their peers, that is those babies born at term. These babies are going to be completely normal neurologically, provided they didn't suffer any effects of asphyxia or other system complications. In case they suffer from the ill effects of various systems, they can have problems like cerebral palsy, mental retardation, blindness, etc. So it is very important to prevent these babies against these complications. Great people like Isaac Newton, Winston Churchill and Picasso were born premature, and they have attained such a high potential in their life. So there is no need to be afraid of. Mothers have to take care of these babies by giving proper feeding and looking after all the complications. These babies are completely going to be normal. Birth asphyxia is the leading cause of neonatal death in our country. If the baby is not taking respirations at the time of birth, this is known as birth asphyxia. Because of hypoxia, that is less oxygen supplied to the brain, this can result in various system complications. In fact, the first 60 seconds after birth are the most essential in any individual's life. If this period is going to be normal, in future he will be a normal individual. If he suffers asphyxia or hypoxia during this period, he may become a mentally subnormal individual. The various causes of birth asphyxia are either maternal or fetal. If the mother has suffered from poor nutrition, or if there is toxemia of pregnancy, maternal hypertension, fetal causes like fetal hypoxia result secondary to fetal distress, meconium stained liquor, or twin presentation, cord prolapse, or twin presentation, these conditions can result in fetal hypoxia. So at the time of birth, these babies may not be taking adequate respiration. If a baby doesn't take respiration at the time of birth, immediately it should be warmed, and the most important step is provision of oxygen to the baby. This can be carried out with an instrument known as ambu bag. This provides oxygen at a higher concentration. If it is connected to oxygen atmosphere, oxygen from a central source, this will provide 100% oxygen to the baby. We have to give ventilations at the rate of 40 per minute. In certain cases, endotracheal intubation with the laryngoscope is essential to provide prolonged ventilation to the baby. Most of the time, the heart will start functioning after adequate ventilation. In certain cases, cardiac compressions and drugs like adrenaline may be necessary for proper initiation of action of heart as well as the lungs. In case the asphyxia is going to be prolonged, baby can suffer from various ill effects due to metabolic problems like hypoglycemia, hypocalcemia, etc. If the birth asphyxia is prolonged for longer time, baby can suffer from damage to brain, and this can result in intraventricular hemorrhage, aspiration, necrotizing enterocolitis, like various system complications. So birth asphyxia is a condition which should be prevented and in case it is inevitable, that case it should be treated at the earliest possible. Jaundice is one of the commonest problems during neonatal period. It is due to rise of unconjugated toxic bilirubin, which can cross the blood-brain barrier, producing ill effects on the brain like kernicterus. The problems of jaundice are due to unconjugated toxic bilirubin. Nearly 70% of preterm babies and 60% of term babies can have jaundice in the neonatal period. In the first 24 to 48 hours of life, if jaundice appears, or even before that also if it appears, that will be most probably due to some reason we should be treated. There is another term called as physiological jaundice. That is, babies can have jaundice even normally also. Usually, this type of jaundice will start its onset between 48 to 72 hours of life or after, and it will come down by 7 to 8 days of life in case of term babies. In case of preterm babies, the onset may be the same, whereas the extent may continue till 10th day of life or even 14th day of life also. The causes of hyperbilirubinemia needing treatment are blood group incompatibilities like RH incompatibility or ABO incompatibility, certain RBC enzyme deficiencies, or when there is trauma to the head, scalp injury resulting in cephalhematoma. Other important causes are neonatal infections, congenital spherocytosis, and thyroid deficiency known as cretinism, etc. When the jaundice is rising toxic level, as we are seeing in this baby is icteric, that is, jaundice is present till soles. This level indicates high level of serum bilirubin. This can cross the blood-brain barrier, resulting in brain damage, and this condition is known as kernicterus. Before the baby goes into kernicterus, we have to take certain steps like keeping the baby under phototherapy, and if the jaundice is very high, we have to do exchange transfusion. Phototherapy is exposing the baby to a light radiation in the wavelength of 420 to 450 nanometers. The light at this range, either blue light or green light or white light, this will transform toxic bilirubin into water-soluble photoisomers, which can be excreted in urine, thereby decreasing the levels of toxic unconjugated bilirubin. In case the serum bilirubin is exceeding very high, we have to change the blood of the baby. This procedure is known as exchange transfusion. After changing the blood of the baby, we have to continue phototherapy till the levels come down. If the baby suffers from kernicterus, it will have severe complications due to brain damage like poor hearing after infancy, and there can be brain damage resulting in cerebral palsy or mental retardation. This condition requires early recognition and treatment. I would like to mention certain of the important facts regarding maternal care in early pregnancy and early neonatal care, because these are the deciding factors for neonatal care in the latter period of life. Every mother should take care of while using any drugs in the early trimester, that is in the first 3 months of life. These medicines are most of the medicines can result in certain abnormalities in the baby. For certain drugs, it is well known that they can produce abnormalities of limbs or neural tube defects or hematological complications in the baby. So as far as possible, mothers should avoid taking drugs in the first 3 months of life, and better is in the first 5 months of life. If it is inevitable, they should be taken with physician's advice only. All the pregnant women should take 2 doses of tetanus toxoid to prevent possibility of congenital tetanus in the newborn baby. Vaccine should be given to all the babies, premature as well as term babies, at proper time, starting from 6 weeks of life onwards. BCG vaccination is given at the time of birth. polio and DPT can be started from 6 weeks of life afterwards and can be continued. Vaccination to babies is helpful in preventing the dangerous diseases like tuberculosis, polio, pertussis, tetanus, and whooping cough, etc. I want to mention about certain of the important aspects of neonatal care. They are being practiced as customs in our society. One of the important ones is avoiding colostrum. This colostrum is the breast milk secreted in the first 2 or 3 days of life. This is yellow in color, that's why it is felt to be bad, but it is not so. It is very rich in immunoglobulins which are essential for the baby. So it should be given to the baby. It should not be discarded. Branding is another important custom which should be avoided. Similarly, putting oil into nostrils and ears of the baby should also be avoided. It is custom to give gripe water to babies, but this gripe water contains alcohol. For example, if a baby is receiving 2 teaspoonfuls of gripe water per day, that is equivalent to an adult consuming 500 ml of alcohol. You know the ill effects. So, gripe water should not be given to the babies.
We have so far learnt about the problems of newborn babies and the importance of neonatal care. Newborn children are powerless. They depend on us for proper care and prompt identification of problems, if any. This prayer of a premature baby should set us thinking. I came too early, I came too late, from the womb to the cold room, struggling for breath, dying to survive, hungry for food to keep the brain alive. The invisible enemy threatens through you, the yellow pigment, ever ready to cripple, lungs too light to get oxygen to blood. If only you care, I need special care. My brain bleeds with strain, blood channels too fragile. Be gentle, be kind, be warm for a while. By your thoughtful care, given this start, I may be Churchill, I may be Napoleon Bonaparte.